Be ready for the breakouts too, I know it. All right. So your team today includes, and remember we said small agencies may not have, different people in each of these roles. You may wear multiple hats and that's fine, but you always want to be looking at things from an executive perspective. We've got the decision makers here today. We've got the program leads here today. Folks who are thinking about this, how does this operationally directly affect the people that we're trying to serve? And then also people who look at this from a fiscal lens, because we're here to talk about budgeting. We're here to talk about revenue projection, here to talk about supervision and how all of those things lead together. So grateful to have you all here today. And if anybody signed on late, just put your name and your agency in the chat. So here's where we are in the schedule. We're in week 3. We've done provider enrollment and orientation to the Medicaid Academy. We talked last week about participant enrollment and service eligibility tracker. Folks should have that as well. These are some of the documents. If you sign into our SharePoint, we're able to share with you more easily. Today, we'll talk about staffing and budgeting. A lot of tools here today. The services budget tool, time study material tools. We'll do policies and procedures next week, documentation and billing, week 5, and then finally quality assurance. And as always, we will have on Friday afternoons, we will have an optional Q&A session. Questions come up to you. This is a lot of material. Start putting things together. You're like, I didn't get a chance to ask this question on Wednesday. You always have time on Friday as well. Yes. So, as always, our Medicaid Academy materials are being posted. Thank you to Monica and Jennifer, who are posting all on the 1915I website. We'll have the recordings. We'll have all of these slide decks. We'll have all of these links. Again, as Rachel said, if you sign up and are allowable into our SharePoint, you should be able to grab those links just from all of the from the slide deck material. And then we've got tools today. This is what Rachel sent out, the Dropbox zip file, services budget tool, and time study tools. If you don't know what that means right now, all good. I promise you will know by the time we get to the end of our sessions. All right. And another slide that we do every time, Department of Human Services. Monica's not with us. She's away at a conference, but I believe Jennifer is. Jennifer, you're here, right? Can you say hello?
Yep, I'm here. Hi, everyone.
Thank you for being with us. And thank you, as I always have to turn to DHS for many things. I appreciate you taking those questions, answering as you can. So yeah, so DHS really gives us the guidance, the policy requirements. The TA team, Ambrosia, myself, Rachel, our idea is to help you with, our role is to help you with the how. How do you fulfill those policy requirements? How do you fulfill those regulations in an operating and functional services / business? Each session will give you the tips and tools we'll talk about, opportunities for agencies to share across, and coaching for your agency, time for your agency to come back, look at your work plan and say, what do we already have in place? What do we need to modify? What do we need to start from scratch on? And this is going to be true for all of our sessions. And there will be individual TA after we get through the Medicaid Academy materials. We'll be talking to agencies about how we engage and support you there as well. So for session 3, we're going to plan a time study, and we'll explain what that is. It helps you develop valid information for revenue projections. You're going to hear a lot about a discussion of what's called billable time. And that's a really important concept for people to understand. The Medicaid benefit is paying for many of our services in the 1915I is paying on 15-minute increments. What's a billable time? What's billable time? What 15 minutes of staff activity is billable? What time is not? You've got a couple other services, non-emergency transportation. That's basically trip-based. Every time you trip, you bill for that, etc. There's a couple of other services that are what are called per diem. You do something and then you get paid for that day. We'll think about the differences between those services and help you develop time studies to know how much time of your staff's work will be billable, and therefore to help you develop revenue projections. We want to help you get all the information you need to estimate what we call your total cost of care. What does it take for you to actually deliver this service? And how do we make sure that you have funding sources for all of the aspects of this program that you need to implement in order to implement a quality and compliant program? We're going to talk about staffing models, and we'll share CSH's services budget tool, and we'll practice using the budget tool, the time study, and revenue projections tools. Many of our tools are focused on housing support services, and we're in the midst of making revisions to them because it feels broader than that. If you are not offering housing support services, though, but you are offering a tool, if you are offering a service that is billable on 15-minute increments, most of the, I would say all of the, from a revenue projection and from a revenue model and from a time study projection, That's all the same. What you do in that 15-minute increments is different, whether you're offering benefits navigation or whether you're offering peer supports or whether you're offering housing supports. What the actual activity is, what's billable under the state service definitions will differ by the service, but how you manage the service from a revenue projection, it's pretty much the same as long as we're all on the 15-minute increment space. I think about it a different way. If my role was the fiscal lead, it's all the same to me from a revenue projection space if we're doing a 15-minute increment service. From a program lead, if I'm thinking as a program lead, absolutely not. It's very, very different services there. So think about those challenges. Think about that when you see that. And as I said, we're in the midst of adapting all the materials to make sure that they're not, just don't call out housing support services, but call out all those other services as well. So that's what we're going to cover today. As we think about each of these, we think about the Ford lenses. We look at this thing every time as well. Again, small agencies may not have one person who thinks about one of them. I think strategic, you think programmatic. You may have to wear all of these hats, but spend some time wearing each of these hats. Programmatically, service provision, what's my staffing, what's training and support do we give to our staff to retain our staff to make sure they're delivering a quality service? How do we monitor compliance requirements as well? Compliance is a very important characteristic in Medicaid programs. How do we think strategically? Who are we partnering with? What's our long-term goal for our services here? What other funding streams are we braiding here? Who's our board overlooking our services? Who's our business partnerships? Who's our board guiding us forward? We look at this from analytical perspective. What information do we need? How do we manage that data? What quality improvements processes do we have in place? We look at it from finance, there's data there, from operations data, how many people are we staffing, how many people are we serving, how many people are our staff, and legal guidance as well. Finally, we think of logistical, just how do you do it all? How do you do billing? How do you do policies, policies and procedures, highlights our next session, how you do it all? What legal agreements do you have in place? What HR agreements? What information technology do you need in order to make this service work for you and the people, for you as a business and for the people you serve, most importantly? So I think we heard from Monica and Jennifer in one of the first sessions that the state is really shifting away from what we used to call program funded services, what many people call grant funded services, and the administrative world in the grant places in the grant world we have outlined here. Very, very different. In the grant world, we write the grant, we get paid, meaning awarded the funding, we do the work. Then we write the report that tells the funder, hey, we did the work. These are our good outcomes. This is what's value in our work. You will see that get paid is step number 2 in this process. Healthcare world, very differently. We talked about provider enrollment. We talked about agreements with the state or with the MC or with Blue Cross Blue Shield. That's what happens first. Then you do the work, you get people signed up for the service, you do the service delivery, you help people navigate their benefits, you offer peer support services, you offer respite services. After you've done the work, then you have the ability to submit what in the healthcare world is called a claim, what in the grant world may often be called an invoice, and then you get paid. This is a real shift for agencies who've been doing grant-based work for a long time. You're going to need to think about how do you maneuver this transition, and you're going to need to think about this from a cash flow process. And we'll talk about a little bit about that in session 5. But again, because get paid went from being step number 2 to step number 3, and the timing of it is out, meaning that you normally know when you've got regular funders, you know how long it takes for them to pay you if you get an award. In Medicaid, it's somewhere between 30 to 90 days from when you submit a claim, the claim goes in and it's accurate and it's all accurate and allowable, and then you get paid 30 to 60, 90 days after the state or Blue Cross says, yep, these claims are good, this is all done correctly, etc. So lots of a different shift. Think about that from a cash flow perspective. So what do you need to drive your decision making? These are questions. We're going to help you. There are not answers. There's not one right answer to these. What there is in these is we're going to give you some tools to help you come up with the answers for this for your agency. So one, you've got new costs to be a new Medicaid related agency, and we'll share you a list of those and how to fill that out for yourself. We're going to talk about a time study. If you're doing services on 15-minute increments, and most of the 1959 services are 15-minute increments, you have to estimate how much revenue you're going to generate. How many of your direct services staff are spending their time in billable time? And we'll talk about that concept of billable time. We want you to know what it costs to do the services, not just to pay people, but all of the administrative pieces that support a Medicaid program. So you want to be able to think about your total cost of care. For my 15-minute increment, keeping this person in housing, helping this person navigate their benefits, it costs us the X to do the work. We project revenue of Y. Is that a profit? Is that a deficit? If it's a deficit, how do you fill that deficit, etc. So we want to help you as you build into your decision-making process, set reasonable goals, develop the work plan, and be able to do some realistic revenue projections for your agency. We don't want anybody, we want this to be a fiscally sustainable program for people. We don't want agencies. We've seen agencies go out of business and just left people hanging, and that's not what we want. We really want to help you from the ground up build a fiscally sustainable business. So, and we want your team to build an understanding of what's included in the services, what will it cost for your agency from day to day. That's housing support. I should have shifted that because that's for any other service that we want you to understand what your bottom line costs are. So we'll talk about that today. End of the day, your goal is to deliver quality, supportive, healthcare related services, primarily funded through Medicaid in a fiscally sustainable manner. So this is all about how do we take these are the services we're offering. These are the people we're serving. This is the rates that the state's already given us. These are the regulations that the state's already put in place. And how do we project out what our revenue, what our revenue goals are going to be? How do we project out how to make sure that we're running a fiscally sustainable business? So what are those costs? Let's start thinking about what those costs are. One, we've got a list here of one-time costs, meaning this is something you're paying for up front. Remember I said get paid is step 3? This is all the things that go into step 1 in the healthcare world. What hardware do you need? What cell phones? What laptops? What sound machines if you're in an office setting? What vehicles? What locked cabinets do you need for additional security? That's hardware costs. Software related costs. What billing system are you using? What data collection information? How do you track outcomes? How do you gather data and information? This is the analytical lens. How do you gather information that talks about what are our outcomes? How many people did we get into housing? How many people were we able to successfully navigate their benefits? How long were we connected to people in peer supports and maintain their recovery? Tracking the tenant information, tracking customer surveys, we'll talk about that. And then if you choose to, what electronic health record do you have? What electronic health record are you using? What electronic health record or billing system really meets your needs? People often in these sessions ask us, can you recommend a billing system? And the answer is we can't. I've done this work. I've worked with billing systems. I've started up billing systems in the past, but every program is different. Every service is different. And I will tell you, only take advice from people who are actually using the system day to day. So if any of you have an electronic health record or electronic billing system that you're using and you really want to recommend it, please put it in the chat, get your name and your information there. If you've been challenged by ones, that's important information to know too. The state is required to develop what's called an electronic verification visit system, or EVV. North Dakota has chosen what's called the THERAP system, THERAP. And there is some discussion about could THERAP be used as your primary billing system? I don't believe that that's been determined yet. Jennifer, if you know any different, or if you want to, I know Jennifer's able to text Monica. She's not able to join us today. But anything you want to tell us about what you know about where the state's conversations are around THERAP. But I know that's an evolving conversation. I don't think it's determined yet, but please correct me if I'm wrong.
Yeah, they are working on something that's a little more streamlined or a little easier, but it's what we found is that those things take a while to develop. So thank you for everyone's patience. But yeah, there's a lot of conversations in the background about how we can keep growing. So,
but we're in the development stage with that. That continues to be the state's vision, that people could use THERAP as their billing system.
Yes, I think they'd like to have things more cohesively located in one space.
Yep, that makes perfect sense. Yes, multiple data systems will be the death of us. So yes, okay. So these are your one-time costs. Thanks, Jennifer. I appreciate that. We're also consultants. Who's out there helping you? Is this something you're doing all on your own? Hopefully, the Medicaid Academy is giving you tools and templates. You don't need as much that you can modify. So maybe you can do this on your own. Maybe you want to work with some other staff or supports, etc. As you look at your policies and procedures review, that's the next session. Budgeting, that's today's session. What data you're collecting, what information you need in order to both bill effectively and also indicate to funders, et cetera, the success of your program, how it's making a difference for people. How do you do audit prep? What does that look like? We have a section on that in our policies and procedures manual, but everybody has to think about that as well. So these are some one-time costs that you want to calculate into, here's what it costs to manage the business. And then these are your ongoing costs. These are the costs that are not just true for startup. These are the costs that are going to be true every year. And maybe you want an annual budget for some of these as well. One, obviously, direct services staff and our simple budgeting tool talks about how you do revenue projections or help you do revenue projections around the costs related to staff. There's training. How do you make sure that the staff have the required training and support that they need? There's business support. There's individuals who are doing the billing. They're not a directly billable service, but if you're not billing, you're not getting paid. So you need to make sure your business support is strong and has the tools they need to do the work. There's supervision supporting all of these entities. I know a lot of you here are the leaders in your agencies here. So think about how that time and energy gets factored in. There's quality improvement. Medicaid requires that entities have somewhere in someone's job description is looking at quality improvement for their programs. So you want to make sure a person's decided. Larger agencies may have a whole department on this or one person who does this full time. Smaller agencies, this might be just another hat that you wear, etc. But you want to make sure that it's somewhere in the job description and the job role. And then finally, ongoing costs, IT plans, data plans, what data systems you're using, how your staff communicate with each other, etc. These are all part of ongoing costs that you have to factor in. When we get later to the day, we're going to talk about what we call our simple budgeting tool. That basically covers the staff costs. And it helps you think about, okay, I'm paying people this much money. They generate this much revenue. What does that cost? And then we have the larger, more broader, what we call the services budget tool. And that thinks about all of these different buckets. It thinks about the last slide and your startup bucket. It thinks about this slide and all of the other supports. If you're new to budgeting and revenue projections, the simple budgeting tool is a great place to start. Kind of get your head around it. I know I'm a clinician by training, not an accountant. So it took me a while to kind of get my head here. But I think the services budget tool, once you get grounded in that, your fundamental, your biggest cost is usually your staff. But ultimately you have to think about all these other pieces as well. So, yeah. And as always, if there are questions, please stop me, put something in the chat, or Rachel stop me, or raise your hand, and we'll go from there. All right. So the question we have for you today is we want you to be able to estimate your revenue. What revenue will delivering the services bring in? So you're going to have to answer these questions in order to use our tools and think about this. One, which services are you currently delivering? Is your goal to deliver peer support? Is your goal to deliver supportive education, supportive employment, respite? How often are you delivering them? How often will you see people? What's the volume? Will you see people once a week, twice a week? Will you see them for an hour at a time? See them for 15 minutes? What's the location of that service? Most of these services have a requirement of how often you see people in order to be continued to need the service, to deliver the service, and the location as well. Most of these services require a face-to-face visit or a community-based location. You can't just have people coming into your office. These are not office-based services. These are home and community-based services. You're going to hear me talk a lot about, and probably have this link 3 times through this PowerPoint, is also this 1915I service definitions. These are all from the Department of Human Services website. If you are doing something that's deliverable under the service definitions, that is what we call billable time. That's where we get to the time studies and you begin to project how much time is what your staff doing is billable. You also want to look at who you're serving, their demographics, whether they're eligible or they're already enrolled in Medicaid. Remember, if people aren't enrolled in Medicaid at the day you deliver the service, you can't bill for the service. So it's really important to stay on top of people's enrollment. How much time people need, how much effort, how many hours you're billing, 15-minute increments, I should say, you're billing with people based on the level of intensity of need. We really want people to get the right amount of service, the service that they need in order to maintain their recovery, maintain in the community and community integrated. We don't want them to go to too much service. That's really a waste. We don't want them to get to too little service. Then they're not going to be successful in their goals, in their person-centered plan goals. So think about that from a level of need and the number of people you're serving by service type, etc. These are all pieces of information that when we get to some of these bigger tools, you're going to need to have your agency answers for. Again, these are not questions with right or wrong answers. These are questions with what works for your agency, what works for your community, what works for the community needs that you're trying to address through this process. So to help you get there, we have what we call a time study tool. Our time study tools help you measure productivity. Basically, I will go into them in more detail, but what the time study tools help you do, and we have a time study guide, we have a blank one, and we have an example ones. And that is determine what's the percentage of productivity expectations you have for your direct services staff, what you also might call your revenue generating staff. Then we have the bigger, broader services budget tool. Information that you come to from the time study is going to need to go into the services budget tool. The services budget tool basically says, here's what it costs to deliver the services. Here's the revenue we expect to generate from our productivity assessments from the time study tool. Here's the profit or here's the deficits. And so that you can think about how you address those change. If those, it's never 0-0. It's never, oh, we just met our costs, all good. But where you are in that is going to be really important for you as you look to maintain your business over time. So, and I will just highlight the 2 links over here. We're going to send all the materials that's in the Dropbox, but these are the kind of links that once you sign on to CSH's SharePoint and we've shared these documents with you, you should be able to just download them and adapt for your agency. So let's get to, here we go. I'd like to use the light bulb graphic is what I use every time. Like, this is a big idea. That's a really, really fundamentally important idea for the session and for your business going forward. Today's big idea is billable time. Whenever direct services staff are with a service participant and they're engaging in activities that are part of the DHS service standards, and that's the link there to the state website, that is billable time. Your time study work is going to try to help you consider how much time is billable and therefore how much revenue am I generating. The service definition documents are very focused on meeting the goals of the person-centered plan. So it's important that as much as possible, you try to maximize billable time for your staff. That will maximize your revenue. That being said, it has to fit under the DHS service definitions. So your documentation is going to need to be clear about why this is billable time. So for example, I have someone say, oh, Marcella was faxing these documents. Well, written as faxing is actually not billable time. But if the documentation, the note says Marcella was faxing these documents with service participant Jennifer to help Jennifer apply for housing as part of her housing support related service, that would be billable time. I'm with the person, I'm teaching them how to use the fax machine, how to gather their documentation, how to get that documentation to the right place in order to that they can be considered for housing under a housing support service. That is all billable time. Oh, we're playing basketball. Well, basketball really isn't billable time. Oh, wait, I'm working with a peer support worker and working with an individual in order to help them achieve their recovery goals and in order to come up with social activities to be engaged with to help them maintain their recovery, which also happens to be basketball. So I'm playing basketball, I'm with somebody playing basketball, not billable time. I'm supporting someone in order to find social activities that support their recovery long-term and that are not focused on alcohol and drug use. That's billable time. If you notice in my example, what's actually happening, if you're watching this activity, it kind of looks the same. You've just talked about it in a different way. But talking about it in that different way so that it circles back to your person-centered plan goals, talking about it in a different way so that it's an allowable activity under the DHS service definitions, and you use the documentation from the DHS and you use the language from the DHS service definitions, is the difference between being able to bill for time and not being able to bill for time. That's a really important concept that I want to make sure folks get. So I would love to hear from anybody. Do you have another example? Does that make sense? Tell me how that's coming across. I want to make sure folks are getting it. Even just a billable time. Can you think about what activities that you're currently doing with residents that you think would be billable time? Oop, are folks putting stuff in the chat? I can't see the chat. I'm not good enough on technology to be able to move the slides and see the chat.
I am monitoring the chat. We just started getting some responses here.
Awesome.
Response. Yep, one response that we have is applying for SNAP benefits.
So that is part of benefits navigation. So if you're billing for a benefits navigation service and the person is with you and their person-centered plan says one of their goals is to be enrolled in all allowable benefits programs, then yes, enrolling for SNAP's benefits would be a billable time. That would be great.
That's all we have for now in the chat. Oh, wait, here we have another, applying for Social Security.
That's also for social, exactly the same as with SNAP's benefits. But again, it's got to link back to, you have to be delivering benefits navigation, and you have to be, you have to link it back to the person-centered plan. I will also say that it could also be included under housing support related services, because housing support related services includes helping people apply for income that can help them pay rent. So if you frame this as, this is helping people increase their income, that Social Security, this is helping people increase their income in order to be a desirable tenant, in order to be able to pay a portion of the rent, then that would also be a benefit as well. Thanks for the help, Rachel.
No problem.
Billable time, really important concept. All right. Everyone's going to want to know the rates. This is the DHS fee schedule. These are all of the different services that are listed under the 1915I. And this also tells you, are they by 15-minute increments, which is when we get into the time study? Are they by service, training and support for unpaid caregivers, non-medical transportation? That's by trip, etc. But I think almost everything else is per service. Is there a per diem? Is respite? No, respite's 15 minutes too. So yeah, so everything is by per 15-minute increments. So if you are doing one of the services that is by 15-minute increments, then the next section on time studies is for you. Yes, so time studies done best, you go to your staff, or maybe you're the direct service person too, and you say, okay, what do I do all day? What am I, what activities am I engaged in? Am I with the client present or not? How much time did I spend on them? What was the exact time? This is just an example, a very old example, as you can tell. And because the question becomes that you're going to take this information, tell staff you are not, this is not sort of a new monitoring for larger agencies. This is not a new monitoring. We need to know what you're doing all day because we need to figure out how much of these activities are billable. You need to think about that from a funding stream perspective. So you're trying to figure out just what staff are doing all day exactly from times, and is that a billable time? Is that a billable 15-minute increments or not? When we get to the billing section, we'll talk about 15 minutes. What if they're 9 minutes? What if they're 22 minutes? We'll give you every minute down in the section 5, etc. But for now, just time study is gathering information. We recommend that this be done for 2 weeks with your direct services staff and have them just fill out this basic, and this is part of the zip file that Rachel shared. There's an example here, there's a blank form that you can use, etc. And there's also a guide to help you use it as well, basically saying all the things I'm saying here now. So learn what is it your staff are doing, how much of that activity is billable, and how much of the activity is not billable. That will give you some average revenue projections, productivity requirements. It won't give you revenue projections, I'm sorry. It will give you productivity requirements. How much, or projections, how much of the time that staff are spending out in their field. If I have a 7-hour workday, I have an 8-hour workday, how much of those 7 or 8 hours is billable? How much of those 7 or 8 hours are not? And you want to look at that under the revenue, under the DHS service definitions. So for everything, so at the office, filled out the rental application with Molly. You were there from 9 to 9:45. Molly was with you. Under housing support, that's going to be 45 minutes of billable time, or what you might call 3 units of service. Staff meeting, important, have to have it, but it's not billable time. Nobody is projected to, we usually don't recommend that anybody be projected to be productive from a revenue generating standpoint higher than 75%. And we'll talk about all the other things people are doing in that other percent of the time. But you see, here are the examples, and some remote support is allowed under the service, some remote support is not, meaning you do things for the client, but not with the client. That's something we have to look at as well. I'm gonna have to look before the North Dakota rules on that one. So here's just an example. You do this for 2 weeks, you gather all the data, you say, okay, how much time, each of us as an individual, what percentage of our work time was billable, what percentage of our work time was not billable. You're using this to try to understand your total cost of care, what revenue you're expecting your staff to generate under the 1915I services. You need to be able to estimate caseloads. How many people are you seeing? How many people are you seeing every day? I'm sorry, not every day, but how many people you're seeing in a day? What percentage of their time will be billing? How many 15-minute increments does that mean? That's what's called a unit of service. And then you want to estimate what you think would be productivity requirements by your staff member and by the rate. You're going to need to understand all of this in order to be able to use the services budget tool and the simple budgeting tool to see where you are in regard to long-term fiscal sustainability. So that's why we do this work. Please share this with your staff. Please share that messaging to say, this is not us checking up on you. This is trying to figure out how much of your time is billable and how much revenue do we expect to be generated by that billable time. It's important. Funders, managed care, the state often always wants to better understand what your total cost of care is and what goes into your total cost of care. Conversations where the providers say to the state, we're not getting paid enough and you don't have any backup documentation, don't go very far. You're probably not getting paid enough, but they don't go very far if you can't back up exactly what your revenue needs are and what that will be going for. So yeah, that's why I like those other 2 slides, because staff are saying, well, but you can pay for your direct services staff with the rate. And we're like, oh, but there are all these other things that have to be in place as well. My slides are not. All right. For some reason, my slides are not. Slide. There we go. Okay. So estimate productivity. Nobody's productive at 100%. Nobody, not ever. Be conservative in your estimates. Here's what people are doing when they're not being productive. They're not being productive. They are not revenue generating. They're taking time off. They're on vacation. They're at sick time, bereavement. They're doing administrative tasks. Documentation time is not billable time. They're doing non-billable services like outreach or collateral contacts. They're taking lunch. They're a new hire ramp up. People haven't started yet. You have to train them. Training time is not billable time. Professional development time ensures you have quality staff. It's not billable time. Authorizations, any kind of administrative pieces, people fixing rejected claims, people doing quality assurance activities, all required, all essential to develop a quality service, all not billable time. As I said, for single site buildings, we don't recommend that productivity requirements be higher than 75%. And for if everybody's in the building and you're just moving between buildings, we don't recommend above 75% for where you're driving around in the community, doing different services, different people's homes, et cetera, that may not be near each other. You all are a rural state. There's a lot of travel time involved in delivering services. Travel time is not billable. That's a federal, that Congress actually passed that law. So DHS can't change that. But that's also, travel has to be factored in when you're estimating productivity. So here's our first tool, which is the simple budget forecasting tool. This is looking at your direct services staff. You've got John Doe, he's one of your case managers. You're paying him $22 an hour. It's $45,000 a year. Here are all the fringe benefits, taxes you have to pay, et cetera. So what that costs, and then annually and monthly, what it costs for you as an agency to employ John here. The simple budgeting forecasting tool, you should have that link, or it should be in the Dropbox. You should be able to download that. Obviously your names will be different, your positions will be different, but you can put all of these assumptions in there, and the spreadsheet is built for you in order to be able to do, in order to share that information. So that looks at simply, what does it cost to employ a direct services person? And then when you get to revenue forecasting examples, here's what we have as well. Your position is housing support worker, peer navigator, training for caregiving, whatever that role is. How much time do you estimate that is going to be billable? This is what you take your time study. You say, oh, it looked like on average 50% of our time were billable, 80%, not 80, 30% of our time was billable. You're in a rural area and you're moving between houses, et cetera. So, but whatever that number is, how many hours are they working a week? How many units of service does that generate? Basically, if your units of service are the way we get away from saying it's not how many hours, it's how many 15-minute increments, because that's what you're paying on. Housing support has a $10.70 rate. And then the spreadsheet will give you both your annual revenue and your monthly revenue by John when John is working full time. It also gives you the note. It tells you, here's what it costs. It costs $65,000 to employ John. He's at 73%. We're going to generate about $64,000. That's a small deficit there for employing John. So that's what you have to think about. And then how is it that you go about fulfilling those deficits? So this is a spreadsheet that you guys can download, you can play with, see if that works for you. Any suggestions or examples, or what's helpful, what's not about it, we always want to try to improve our tools. So that is how you think about revenue forecasting. And then finally for today, before we go into breakout rooms, is we have a larger services budget tool. Now remember, the simple budget tool is, these are the direct services staff, here's what it costs to employ them, here's what we think they're going to generate in revenue, here's the deficit, here's the gap. The services budget tool, and we're still working on this because it's very much grounded in supportive housing, we're working in adapting it for housing for other services here. But again, it's functional to all 15-minute increments. It tells you who you're serving, it tells you how many times you're seeing them, and then it tells you what revenue you think you're going to generate and what all those other costs, not just what does it cost to employ John, but what does it cost to supervise John? What does it cost to make sure John has a phone and a document and an electronic billing system that he or she is documenting into, et cetera? What does it cost to do all these other things? That's what you get from your services budget tool. We do this for a number of different staffing models. If you're doing North Dakota Housing Supports, I recommend that you look at the housing-based model there, et cetera. And it gives you a couple of other tabs. One, housing support services is most similar to the supportive housing tenancy support services. This is your tab 2. This is your summary. You don't put into here the green tabs. You don't put in here. You just put into blue, and then these others will populate for you. But it'll give you how many FTEs did you put in, what's your annual program budget, what's your startup related costs. These are the, remember there was a slide back there that said, these are all the things if you're starting from scratch in a new Medicaid program, you have to go get, how are you funding that? So you want an estimate of your startup costs, how many people you're serving, how many units of service do you project a year coming from each person? What's your cost per unit? Meaning in order for us to deliver the service, here's what it costs us to do that service. That's something that when you go into conversations with the state and you're trying to advocate for a rate increase, et cetera, you need all that background and information. So this gives that to you. And then it tells you, what does it cost? What does it cost to serve a person for a month? What does it cost to serve a person for a year? This is the budget summary output. You're going to go back into all of the blue slides, like you see many blue up here, housing support related services, and you're going to fill that out for what makes sense for you. Who are your staffing? You see, is your staff full-time and your staff part-time? How many hours a week you work? What's your productivity expectations? You get that from your time study. You make a guess there for your time study, and then it tells you. It gives you it calculates all this in here for what are your wages and salary costs, what are benefits costs. If you go down, when you download this tool, you'll see a lot of other costs that are in there. It also lets you build out revenue projections for the next 3 years. So what's it going to cost you to do business, both in the startup and for the next 3 years? And then it will let you to summarize all those related costs, and then summarize what it is you expect from revenue, and then summarize what your gaps under profit is. So this is for the housing supported services model, but any 15 minutes increment service, this would work for. This is a piece we just had, the agency assumptions, how many hours a week you're working, how many units of service are an hour, it's always 4. What's your productivity expectations, holidays, times off, days off, et cetera. All that has to get calculated in to your expectations. And then you get an annual, it will calculate for you, given all of these expectations, there's annually what we think a unit of service before, how many units of service will be billed for in a year by a single FTE who is a direct service professional, if they work certain numbers of days a year. So yes, assuming a 5-day work week, assuming the holidays, days off, things of that nature. This lets you make the cost estimates for you. Again, this is downloadable from our website, or you've got it in the Dropbox as well. Any in for the blue is something that you can put in numbers of what is accurate for your agency. There's another tab on general startup costs. I think this is tab 8. I can't see it because I'm in provider. I'm sorry, I'm in presenter view, but this is estimating general startup costs, what it costs to advertise for staff, signing bonuses, background checks, all different things, staff development and training, all of those things that you just never think of when you're starting a business, but cost money if you're paying people in order to work for you. So anything in blue is something that you can put in there, you can add, you can subtract, you can put in what it costs for you, and then that will give you, in that budget tab 2, your budget summary, it will give you all of these general startup costs. And then finally, for agencies that are new to Medicaid, this is your first Medicaid service. This takes you through some additional rules and requirements for Medicaid related services. Do you have a compliance officer? Is that a full-time person? Is that a part-time person? What do they cost? Additional administrative support. This is where you put in your communications. This is where you put in your billing systems. All those costs related there, that's got to get rolled into your administrative costs as well. And so this allows you, again, all of the blue signs are, all of the blue cells are one where you can put what the costs are for you, and then it will roll up into your summary tab 2. So I have done just up, and here we go. I should have gotten another example here. This is what it summarizes down. If you see up here, this is from tab 4. These are all of the all of the costs here. You change that in, you change the mileage, etc. This is a program that may be in trouble. You know what? What we didn't do is we didn't populate the revenue. So this is a program that costs $873,000, but we have to populate the revenue. There's no revenue on that yet. So our hope is that that revenue will at least cover our $873,000 for a 10 direct services program cost. But these are the summaries that you get at the bottom of the tool. So we are going to spend about 15, maybe give folks, we've got a little more time, give folks 20 minutes in your breakout room. So we are at, let me see, we are at 5:01 Central Time. So let's come back at, I'm sorry, yeah, 5:01. So let's come back at 1:20. Sorry, I'm doing the math because I'm on Eastern. So let's come back at 1:20 from your breakout rooms. And these are the questions for you to spend in your times with your agencies. 1, If you need to do a time study, how would you do it? When would you do it? Who would need it? If you're offering a service that's paid on 15-minute increments, just pretty much everything but NEMT and training for caregivers is probably something you're going to need to do a time study on. How do you want to use these tools? Do your fiscal folks want to take the tools, download them, work with them? How do you integrate all of this into your work plan? What needs to be added to your work plan? How is your agency doing revenue projections based on the time study? And we've got to link to the work plan as well. So Rachel, I think this is, oh, any questions? Let me take a pause. Any questions here?
Welcome back from your breakouts, folks. We'll be resuming in just a few seconds.
Thanks, Rachel, and thanks, everybody. I did see one email from Kristen Hansen that said that she was not, the Dropbox link wasn't working for her. And I just emailed her all of the material. So if other folks have that same challenge, let me know. I'm going to try to put my, let's see, where's my chat. All right, put my email in the chat. And make sure you get those materials so that you can keep going forward on your work plans. All right, just give people another minute or so to get back. All right, we should have Rachel. Do we have everybody back?
Yep, we're good to go.
Awesome. Awesome. Thank you for your help. So I'd love to hear from folks come off mute. What did you talk about in your breakout rooms? What are you thinking about in regard to time studies? Do you already do revenue projections? You're trying to learn how to do them. You know, what was valuable here? What did you learn? And what do you need more learning on and more support on? So we want to hear from you.
This is Heather Seminich, Nexus Path. I mean, I can speak for us. Some of these conversations are just a bit trickier, challenging, given our goal is to provide respite services through independent contractors that are our families in the community, just resource families.
Mhm.
So, you know, doing time studies for people who we're relying on, who are just essentially, you know, not volunteering their times, but giving us as much time as they have. It's not their occupation or a job. It's also hard to do sometimes to estimate referral and need, given we're not the care coordinating agency. So they're ultimately the ones that decide what children are eligible for and what they're not. So there's just so many unknowns right now that it's really hard to make any of these projections.
No, that's understood. Understood. So how do you operate in that environment? How do you operate in that environment? How do you get the info you need to manage and build the business from that way?
Well, we just start and try. And thankfully, we have a lot of other service lines. And so we're just starting with existing staff and trying to, get through a few referrals and see if we can make it work. But there isn't a good way to do that, because you can't hire a whole bunch of staff and then
Exactly. And
heck,
then
if
not get the referrals.
when the state plan was approved, if we would have done that, we would have been waiting 2 years for a referral. So
Yeah. Yep. Can't do that.
no,
Yep. Nope. That's attention. Absolutely.
so we're just fortunate enough that we have a, diversity in our business lines enough to just try to start slowly and hopefully, be able to fill a need in our communities, at a greater capacity over time.
No, that makes sense. That makes sense. What about others? Usually folks that are doing services, they're going to be paid for on the 15-minute increments. That's where I think, to your point, Heather, I think this is most relevant to folks who the services they're going to offer are those 15-minute increment services.
But if I understood right, respite and training and support to unpaid caregiver are 15-minute. They are 15-minute.
See, so I am going to go back to the fee schedule because I do not want to steer you wrong.
No, that is correct. Yeah.
So good question you're asking. Here we go. Training and caregiver support is 15 minutes. Respite is 15 minutes as well. Yeah, community transition is per service. Non-medical transportation is per trip. It looks like everything out. Training and supports for unpaid caregivers is per service. Everything else is 15
No,
minutes.
training and supports has 2 rates, either 15 minutes or per service.
Okay. Okay. All right. This is the DHS field schedule, fee schedule. So,
Yep. See,
hope
they're
you've
right
got it
next to
someplace
each
else.
other.
oh, there you go. Thank you. Thank you. Looking at it. That's why I'm like going back and forth. Thank you.
Yeah. Yep.
So that's what you look. So if you're doing any of those 15-minute increment services, that's where the time studies or the services budget tool could be most helpful. So yeah. What about other agencies? What, 6, 7 other agencies? That's Nexus Path. What about other folks? All right. So that is our training for today. More questions, please be in touch. I put my email in the chat here, etc. We've got our Q&A session on Friday afternoon, 3 to 4 Central Time, where we talk about today's topic, staffing, budgeting, revenue projections, any questions that come up for you now. And then we will cover next week policies and procedures. CSH has built out a template, again, for housing related supports. We're working on adapting that template for other related services, but it'll just give you some ideas about what needs to be covered in your policies and procedures. If you're a small agency, you're just starting out, it can be your start and adapting. If you're a large agency, you already have policies and procedures manuals. Think about what things you need to add there, etc. And we need your executive and your program leads for next week. So any other questions? We'll stay on. Happy to support for a couple of minutes, but that is today's session. Stop sharing because I want to see the chat. If folks have any other questions, please let us know. Rachel, as always, thank you for your help.
I was talking and I was not muted. There are no questions in the chat, actually, Marcella. I'm sorry.
So yeah, okay, cool. I think folks are dropping off, so that's good. All right, I think we're good. I think we can shut down for now. Thank you for your help. And I know we've got, I think Hillary maybe next week is